There's just nothing quite like that feeling, right? Getting deep into wrenching on an RC model, everything clicking into place. It's almost meditative until, that is, you get that nagging, dull ache starting up in your elbow. It turns out that for a lot of us, this amazing craft comes with a literal pain point, something people often call, well, swellbow. So today we're doing a deep dive. We're going to unpack what swellbow really is, look at how you can treat it effectively, and maybe most importantly, figure out how to prevent it.
Yeah, the goal here is simple. Keep you enjoying your passion minus the pain.
Exactly, and that swellbow you're describing. Clinically, we call it Olecranon bursitis. Basically, that's an inflammation of the bursa. That's a tiny, fluid-filled sac right on the bony point of your elbow, the Olecranon process. What's interesting, maybe unfortunate is a better word, is its location. It's very superficial, like right under the skin.
Superficial, meaning not much padding.
Precisely. Unlike bursi, deeper in other joints, this one doesn't have much muscle or fat protecting it. That's why it's so vulnerable, especially for us RC folks. All right, so our hobby puts us kind of in the line of fire for this. How exactly do our habits, the hours at the bench, lead to it? It's not just leaning, is it?
Well, the leaning is a big part. That prolonged sort of low-grade pressure on a hard work bench, that's classic. But you're right, it's also the repetitive microtrauma. Think about using those tiny drivers, fiddling with connectors, adjusting linkages. Those small, repeated motions add up. All that irritation leads to inflammation and that characteristic goose egg swelling people notice.
Oh, go the goose egg. Got it.
But here's something really crucial we need to touch on. There's a big difference between non-septic bursitis, just inflammation, and septic bursitis, which means it's infected.
Infected. How would you know?
That's key. Most hobby-related cases are non-septic, thankfully, but you need to watch for red flags that mean see a doctor immediately. We're talking significant warmth around the elbow, noticeable redness, maybe a fever or chills, pain that's severe or getting worse quickly, or, importantly, any kind of cut or scrape near the swelling.
Okay, so warmth, redness, fever, worsening pain, broken skin. Those are doctor visit signs.
Definitely. Otherwise, with the non-septic kind, you might still have a pretty normal range of motion in your elbow, and sometimes, surprisingly, it doesn't even hurt that much despite the swelling.
Right, so assuming it's not infected, it sounds like we can tackle this at home first.
You got it. For those non-septic cases, home care is absolutely the first and often the most effective line of defense.
So what's the plan?
It boils down to the RICE protocol. You've probably heard of it. RICE. First, rest. That means taking a strategic pause from wrenching and really consciously avoiding leaning or putting pressure on that elbow.
Okay, step one, stop poking the bear, basically.
Exactly. Then ice. Apply ice, like a cold pack wrapped in a thin towel, for about 15-20 minutes at a time, several times a day. That helps bring down the swelling and numb the pain a bit.
Makes sense. What's C?
Compression. Use a standard elastic bandage. But here's a key tip. Wrap it, starting from your wrist, going up past the elbow.
Ah, from the wrist up. Why is that?
Good question. If you just wrap the elbow, you risk trapping fluid below the wrap, down in your forearm or hand. Wrapping upwards helps encourage that fluid to move away from the area.
Okay, wrist up. Got it. And E?
Elevation. Whenever you can, try to keep your elbow propped up higher than the level of your heart. Again, it just helps gravity drain that excess fluid.
Rest, ice, compression, wrist up, elevation, RICE. And I guess over-the-counter stuff like ibuprofen can help too.
Yeah, absolutely. NSAIDs like ibuprofen can definitely help manage the pain and reduce some of that inflammation. Follow the package directions, of course.
Now, you mentioned ice and compression. We've seen some products out there like those wraparound ice sleeves. Are those useful here?
It can be, yeah. Something like the old Bones Therapy ice sleeve, for instance, combines cold and compression in one go. That 360-degree coverage is convenient, makes it easier to actually do the icing and compression part of RICE, which is often the tricky bit.
Okay, what if RICE and NSAIDs aren't quite cutting it?
Well, if things aren't improving, that's when you might consult a doctor about other options. They might suggest aspiration, basically draining the fluid with a needle. Sometimes corticosteroid injections are considered, but for superficial bursae like the elbows, injections carry slightly higher risks, like potential skin thinning or even introducing infection. So they're often more of a last resort for stubborn non-septic cases. Surgery is rarer still.
So really focus on that RICE first. How long does this usually take? Are we talking weeks off the bench?
It varies, but yeah, you're likely looking at a temporary break from intense wrenching for maybe 2 to 8 weeks to let things really calm down.
But it is temporary, right? This isn't usually a hang up your tools forever
Oh,
situation.
definitely not. It's a break for healing. Gentle movement is usually encouraged pretty early on, and a gradual return is key. This isn't about stopping the hobby.
That's reassuring. So once it's healed, how do we stop it from just coming right back?
Now we're talking the long game. Prevention. And that really comes down to ergonomics, making your workspace work for you, not against you.
Ergonomics. Okay, sounds important, maybe a little intimidating.
Yeah.
Where do we start making changes that actually, work?
Let's break it down. Start with your workbench and chair setup. You want your bench height so that when you're working, your elbows are bent at a comfortable 90-degree angle.
90 degrees. So maybe an adjustable bench or adding risers if needed.
Exactly. Or adjust your chair height. And crucially, add padding where your arms or elbows rest on the bench surface. Even just a folded towel or a proper gel pad makes a huge difference. Or wear elbow pads yourself.
Right, cushion that pressure point. Good lighting too, I suppose, so you're not leaning in funny.
Absolutely. Good task lighting prevents hunching and straining. Then think about your tools.
Tools. Like screwdrivers.
Yep. Invest in drivers with comfortable ergonomic handles. Look for those little precision drivers with swivel caps on the end. They let you turn the driver just with your fingertips, reducing wrist and elbow twisting.
Swivel caps. Yeah, those are great.
And maybe consider ratcheting drivers for bigger screws to lessen the strain. Then think about your workflow.
Workflow, like how I organize my stuff.
Kind of think about the 5S method. It's just about having your essential tools organized and right within easy reach. Less awkward reaching and stretching. But maybe the single most important thing, take breaks. Frequently.
The classic advice.
Yeah.
Easier said than done sometimes when you're in the zone.
I know, but it's vital. Try the 20-20-20 rule. Every 20 minutes, just look up, focus on something 20 feet away for 20 seconds, and maybe do a quick stretch while you're at it. It breaks the cycle of strain.
Okay, 20-20-20. Seems doable.
So wrapping up Swellbow or Olecranon bursitis, it's basically your body sending a signal, right? Saying, hey, ease up on using that elbow as a pivot point. But the good news is it's usually very manageable with timely care like RICE, sensible rehab, and most importantly, being proactive about your workspace ergonomics.
So it's manageable, preventable, and definitely doesn't have to stop you from enjoying those intricate RC builds. Which brings us to the final thought for you listening. What's one single small ergonomic change? Maybe padding the bench, getting a better driver, setting a break timer. What's one thing you can implement today to help turn your passion from a source of strain into something truly sustainable for the long haul?